This is Sean Huang with Safinea Psychiatry. Today we'll be talking about PTSD screening in primary care settings. Individuals with PTSD often visit primary care with various issues, such as intrusive memories of trauma, avoiding situations related to the trauma, sleep problems, long lasting physical complaints, relationship difficulties, hyperarousal, depression, emotional numbness, and anger. While PTSD addresses the mental health impacts of specific traumatic events, complex PTSD should also be considered. Complex PTSD affects those who have experienced prolonged, repeated trauma. PTSD is often not detected in primary care because screening is not routine. Only about one-tenth of patients who meet the criteria for PTSD have this diagnosis recorded in their medical records. Diagnosing PTSD can be challenging for many primary care providers, leading to it often going undocumented. For this reason, some screening tools can be helpful in identifying PTSD in primary care. The first one being Primary Care PTSD Screen, a short test with either 4 or 5 questions, and a score of 3 or more indicates a positive screen. The Single PTSD Screener, or SIPS, this is a one-question test. Answering bothered a little is considered a positive screen. The PTSD checklist for DSM 5 or the PCL 5 may be a bit long for initial screening, especially when other screeners are being administered to patients. But it could be useful for tracking symptoms over time. Remember, positive results on these screeners do not render a diagnosis of PTSD. A clinical interview will determine whether or not the patient meets criteria for this disorder. If time allows, here are some follow up questions to ask patients who screen positive. Describe the traumatic event or events you're comfortable sharing. How long have you been experiencing these symptoms? Have these symptoms affected your daily life and relationships? Have you sought help for these symptoms before? And if so, what kind of help? Are there any specific situations or triggers that make your symptoms worse? And how do you cope with these symptoms on a daily basis? Thank you for watching. If you got value from this talk, please like and subscribe, and I'll see you next time.